Welcome to the Lancaster General Heart Center. In the next few minutes, we're going to take you inside the center and show you around. You'll meet our very experienced staff, and you'll learn a little bit about what goes on inside our procedure rooms. We want you to be as prepared as you can be if you need to have a procedure performed in our cath lab. There are many questions on the minds of our patients before they come to the Heart Center, like will they have the latest diagnostic equipment? Will the people who take care of me have the right knowledge and the right skills? Just as important, will they be compassionate and sensitive to my needs as well as my family's? In other words, we all want to be assured that we're going to get the expert cardiac care that will deliver the best possible outcome. At Lancaster General, that's our promise. Our team is nationally recognized in the field of cardiovascular care. For example, our cardiologists have performed more than 100,000 heart catheterization procedures. The depth and experience of our team of cardiac professionals is unequaled anywhere in this area. The commitment to excellence in cardiac care is highlighted in our team. 92% of our technologists are nationally certified as registered cardiovascular invasive specialists. Lancaster General is also very proud to have received the Magnet designation for nursing excellence. To be named a Magnet hospital means that our nurses enjoy working at Lancaster General because they're able to provide our patients with professional, compassionate, and quality health care. It all adds up to the best care for our patients. We are also proud to have received the HealthGrade's Distinguished Hospital Award for Patient Safety. Lancaster General is among the top 5% in the country for safe patient care. The HealthGrades Award is given to hospitals that demonstrate high-quality health care and have an outstanding record of safe care delivery. Our professional and compassionate health care is combined with leading-edge diagnostics and state-of-the-art interventions. Translation, you don't have to go to a teaching hospital or major metropolitan area to get top-quality cardiac care. At the Lancaster General Heart Center, we have one mission: to help our patients get their health back on track and enjoy life the way it's meant to be enjoyed, to the fullest. In addition to this tour, you can learn more by visiting lancastergeneral.org and clicking on Heart Center. Now, let's go inside.
Did you ever put your ear to someone's chest and listen to the heartbeat? If you did, you probably heard this. That's the normal sound of the heart pumping blood through the body. To get information about your heart's pumping ability, your primary care physician may first order a series of non-invasive tests. A stress test, an electrocardiogram, chest X-ray, cardiac CT, and other imaging tests are examples of studies that may be ordered. But these tests present only part of the picture. If your cardiologist suspects a blockage, a valve malfunction, or a heart defect, they will need more specific information, the kind they can only get by testing the heart with a more invasive and detailed test. They do that through a procedure called a cardiac catheterization, or heart cath. This diagnostic test shows if your arteries have any blockage, the size of the heart, and how well your pumping chambers are working. If your cardiologist orders a heart cath, you will need to have it performed at a specialized lab like the Cath lab at Lancaster General Heart Center. Here, our highly trained cardiologists and technologists routinely perform heart cath procedures using sophisticated digital X-ray technology. On average, they conduct more than 6,000 procedures a year. With this kind of volume, you can be assured this team has the skills and the experience to provide accurate diagnostic studies with minimal discomfort to you. Here's how a heart cath works. During the procedure, small catheters, which are flexible plastic tubes, are inserted through the groin artery in the leg and advanced to the heart. Then X-ray dye is injected into the catheters. The dye shows your cardiologist if there are any blockages or other problem areas. Now we're going to walk you through a heart cath so you'll know what to expect when you come to the Heart Center for your procedure. The day of your procedure, you should park in the hospital garage on James Street and enter through the main lobby. If you need blood work, a chest X-ray, or an electrocardiogram, your first stop will be in the outpatient lab testing area located on the first floor. Next, you'll go to the Heart Center registration area located on the second floor. Once you enter through these doors, you'll step inside a unique part of the hospital. Soft lighting, warm colors, calming water walls, and plants all combine to present a tranquil atmosphere. We know that patients who approach their procedure in a peaceful state of mind are more likely to recover faster and have fewer complications. When you register, we will confirm your personal information and verify insurance. After registration, you'll be taken to the holding area. A family member or friend may come with you if you need the support. In the holding area, you'll change into a gown. When you're ready, we'll start an IV for your medications and fluids. We'll also give you a sedative to help you relax. As you're taken into the procedure room, you'll notice it looks like an operating room with a lot of state-of-the-art equipment and computer monitors. Once you're moved onto the procedure table, our team will connect you to monitors to trend your heart rhythm and vital signs. After we shave the area around your groin artery, we will then cover you with a large drape. Next, the cardiologist will administer a local anesthetic and insert the catheters. You should not feel any pain or movement of the catheters. You will feel a hot, flushing sensation when the dye is injected, but that should only last a few moments. The dye allows us to take pictures of your heart so we can see clearly if there are any blockages or constricted arteries. The heart cath takes approximately 15 to 20 minutes. However, if your cardiologist decides to fix a blockage, you could be in the procedure room for approximately 1 to 2 hours. After the procedure, you will be taken to the holding area to recover. If you did not need to have any blockages repaired, you will have the catheters removed immediately. But if your cardiologist repaired a blockage, the catheters will remain in place a little longer. You will remain in bed, closely monitored by a nurse for 1 to 4 hours. Family members will be asked to wait in the skylight waiting area on the second floor during your procedure. They will be given a pager that will let them know when your procedure is complete and your cardiologist is ready to discuss your results with them. Based on the heart cath and other tests, your cardiologist will recommend a specific treatment. It could be simply a matter of adjusting your medications, or the treatment could involve coronary bypass or valve surgery. Depending on the blockage, you may be a candidate for a less invasive treatment like balloon angioplasty or stent placement. Your cardiologist will go over all the options with you and help you choose the treatment that's best for you and your lifestyle. No one wants to spend time in a hospital, but Lancaster General is not your typical hospital. It is a patient-friendly healthcare system where both you and your family will find a peaceful and healing environment. At Lancaster General Heart Center, you can trust your heart is in good hands because our focus is on providing top-quality care with the best possible outcomes.